I have to just tell you, while I set this up, that I had to check my calendar at least 3 or 4 times to see what year this was. Some of the confusion is, like Mr. Plancato said, have spent the last 2 weeks in big data circles and an Internet of Things circle, and all I can tell you is that's a conversation you really need to think about a lot before you promulgate practices today if you expect them to be valid tomorrow. And because it'll change everything. It'll change the way you think about data collection. When it's, Julia brought up the Personal Genome Project, which is part of the quantified self. So I wear a Fitbit, you try to quantify all the things going on about you. But the big data and Internet of Things movement is everything around you is quantifying you. And they're sending data to everyone else from your floor, your television. Everything's talking something about you, something going on in your life. And this will definitely change the way not only you'll conduct research, grab data, who you'll get the data from, and also the privacy and other kinds of issues. But the conversation was like 1997. So what I'd like to do is go back to 97 and, if time permits, talk about 2017. So we'll see. So thank you. I should just tell you that I'm a computer scientist by training. And what that means is that computer scientists really look at the future. That is, how do I design technology for tomorrow that can achieve a goal that I'm looking for? In my case, the goal has always been, how do I move technology in a way that will harmonize with society? That is, we enjoy the benefits without the societal harms, and privacy has been a big part of that. I recently took a position at the government, a short-term position. I'm the Chief Technology Officer at the FTC, so I'm required to tell you that anything that I may say does not necessarily reflect the views of the FTC or its commissioners or even my own views. So what I want to do is I want to talk to you about re-identification. And I know it scares you. You could hear the fear in the voices of the people here. I've lived those fears with you, which is part of the reason we're in this position, as I will explain. It's a fear that if a re-identification happens, oh my God, it'll discredit you. And so you use a data use agreement as a way to try to at least make sure you will be protected. And to some extent, that has worked. I've trained over 1,000 students over the last 15 years. Many of them have gone into industry. Many of them are in companies, and there are many anecdotal examples of where data use agreements are violated, but because the bar is so high, if it were to be known, no whistleblower is willing to be the Snowden of environmental health or of health data. But it doesn't mean that harms aren't happening. It doesn't mean that bad things aren't happening. It just means that we've created a system where it's really hard to know that and to show that and to move beyond that. On the other hand, I've also been at your side in some of your offices when somebody wanted your data and you really didn't want to give it for economic reasons, for harms, and so forth. And then your interest was, LaTanya, show me how this data could be vulnerable to re-identification so I don't have to give it. And you can't have it both ways, because now you end up all these years later and we're kind of in the same place we started from. So let's see if we can unravel it. Let me start by saying that re-identification is a sufficient and necessary condition for improving privacy protection. Without real-world demonstrations of actual vulnerabilities and risk, we end up with bad policy and a lack of scientific improvement in privacy-enhancing technologies. We need a cycle to learn more, to improve the privacy protections appropriately, whether they end up weaker or stronger, but more likely they'll be totally different than what we know now. But we can't really engage that. Computer science had this exact same problem many years ago in encryption. It used to be the case that some people would rely on encryption for national security and so forth. Somebody would break it, they would publish it, national security people would freak out, businesses would freak out, somebody else would come up with a better system, and somebody else would break that, and they created this cycle until eventually we got the strong encryption that we use today. So today I can tell you exactly how your credit card is encrypted over the internet, and even knowing how it's encrypted does not make it it does not make it possible for you to break it. We could have never gotten there if we didn't have those cycles. So where are we today? Where has 1997 left us at 1997? It has left us at a political camp in an argument between two lawyers who have political positions. One camp who says everything can be re-identified, and the other is the camp who says nothing can be re-identified. And neither one of them are right? But now how do we clarify it? And how did we get here anyway? And whose fault is it? Well, it might be mine. Or at least I probably played a big role in the problem. What happened, and I think my history is a good example of how we got here. Daniel Barth Jones talked about the Weld example. It is perhaps the most heavily cited. It's cited in the HIPAA privacy regulation preamble. It's cited in preambles in other countries' privacy regulations. And over 20 attempts to get those papers published, none. It was never ever been published. Not because I didn't try, not because I didn't write the papers, but because in general re-identifications are disruptive. So despite its significant history, after all those attempts, we don't have a history to turn to. The very next large-scale re-identification I did was a case in southern Illinois for the Department of Public Health. I ended up re-identifying children on a cancer registry. They scored the results and said that I was absolutely accurate in 20 out of 22 of the cases. The judge saw the results and sealed the case and said, "You may never ever tell anyone how you did that." The next case was New York City. The case after that was the U.S. Census Bureau. In both of those cases, the re-identifications caused alarming effects with data that were already going out the door. And the question was, LaTanya, could you give us time to figure out what to do? And I did, and for years there was nothing done. They just continued to ship the data in the same way as if the vulnerability never existed. And the papers didn't either. And frankly, I was on tenure track, and in computer science, this isn't computer science. This is not rocket science. So we end up where we are today, and the question is, where in some ways I think Daniel Barth Jones or Yakowitz are asking the right question: where's the evidence? And so last year we began a very serious and heavily concentrated effort to produce that evidence in very clear and uncertain terms, sort of reproducing the history. So I want to talk a little bit about what we know, and especially in respect to health there. So we all know that trust begins with the doctor-patient relationship and the importance of that trust and so forth. And so we started a project called the datamap.org to figure out where are all the places that your personal health data might go beyond the patient relationship. So we're not the first to do this. Paul Clayton led an effort back in 1997. This is a depiction out of the For the Record book. I only have 2 minutes, so I'm going to go a little faster. This is what the data map looks like today. And you can visit it on the datamap.org. Every node, if you click on it, will list names of entities, and document how we know they engage in that sharing practice. One of the most interesting things about it is the ones that you see now in bold are ones that are not covered by HIPAA, which is pretty amazing. The other thing that we did, I'm going to skip ahead a little bit, is one of the big nodes there was hospital discharge data. There are about 33 states that sellers share the data. Only 3 states use HIPAA standards. The other 30 states use standards that are weaker than HIPAA. And so we also issued FOIA requests to who's getting the data. And lo and behold, researchers don't come anywhere near the top 50 people, 50 recipients of the list. This is a sample of the hospital data. We bought a copy for $50 from Washington State, linked it to newspaper articles that appeared at the same time period. And so we don't use voter lists anymore, Daniel. We use public records because they're readily available. They're far more comprehensive. Everybody's in it. Your nicknames are in it. Your cell phones are in it. And so we just used that to get the zip code on it. We linked on the zip code to get the hospital data. And we found that we were accurately re-identified 43%. How do we know we were accurate? We gave all of the names to Bloomberg News. The publishers of Bloomberg News and Jordan Robertson, the reporter, contacted each person. They did so under an agreement that only if the person agreed would they actually release the name. And so that they stood with that. We stick with news stories because news stories have the same kind of information that an employer knows about you, a creditor knows about you, your family and friends knows about you, and that you could link the data as well. This is the example of the Weld data. It was a health data set that the point was it could be linked on voter lists, on basic demographics to put back names. There are a lot of myths about how it was done. So in the spirit of this conversation, after tonight, I will put a copy of the Cambridge voter list on foreverdata.org forever, for 1997 Cambridge voter list, so that I will never hear about how the Weld example is not real. In the health information data, those were the demographics. 02138, male 713. We took all of the demographics. It just so happened we also got this demographic. So here's the Cambridge voter list. There are 54,805 names. I sorted it now by date of birth. This is in an Excel spreadsheet, so this is not rocket science. Notice there's no statistical matching. This is just, I sorted it on date of birth. Look, there are 6 people who have that date of birth. 3 of them are men, and there's only 1 that has that combination with that zip code. Who is that person? It turned out to be William Weld, and he was the governor of Massachusetts at the time. I'm going to stop here because this is where we'll talk more about big data and some of the other opportunities that big data affords in a new way of thinking. Thank you.
Thank you.